To diagnose this test. This testing procedures is used to diagnose acute lymphocytic leukemia. First is blood test. Blood tests may reveal too many or too few white blood cells, not enough red blood cells, and not enough platelets. A blood test also may show the presence of blood cells or immature cells that normally found in the bone marrow. The second test is bone marrow test. During bone marrow aspiration and biopsy, a needle is used to remove a sample of bone marrow from the hip bone or breastbone. The sample is sent to a lab for testing to look for leukemia cells. Next is spinal fluid test. A lumbar puncture test, also called a spinal tap, may be used to collect a sample of spinal fluid, the fluid that surrounds the brain and spinal cord. The sample is tested to see whether cancer cells have spread to the spinal fluid. Ano siya? Ang spinal tap, mag-collect siya of sample fluids sa nakasurround sa brain o sa spinal cord. Then i-test na rin to siya whether ang cancer cells kay na-spread siya sa spinal fluid. Next is imaging test. Imaging tests such as an X-ray, a computerized tomography, CT scan, or an ultrasound may help determine whether cancer has spread to the brain and spinal cord or the other parts of the body. So, pharmacologic therapy. All chemotherapy includes the following drugs and also other drugs included in the treatment. These drugs include vincristine, prednisone, cytarabine, L-asparaginase, and daunorubicin, antibiotic, antifungal, and antiviral. So, vincristine is an anti-cancer chemotherapy drug and is classified as a plant alkaloid. While prednisone, this drug is by altering the body's normal immune system response. Cytarabine belongs to the category of chemotherapy called antimetabolites, wherein when the cells incorporate this substance into the circular metabolism, they are unable to divide and they attack cells at specific places in cycle. While asparaginase breaks down asparagine in the body, so since the cancer cells cannot make more asparagine, they die. Daunorubicin. This one is classified as an anti-tumor antibiotic which is made from natural products produced by species of soil fungus Streptomyces, and these drugs act in multiple phases of the cell cycle and are considered cell cycle specific. While antibiotic, antifungal, and antiviral, this controls infection, a common complication of acute leukemia. In general, treatment for acute lymphocytic leukemia falls into several phases. First phase is induction therapy. The purpose of the first phase of treatment is to kill most of the leukemia cells in the blood and bone marrow and to restore normal blood cell production, while the second phase is consolidation therapy. The purpose of this treatment is to kill most of the leukemia cells in the blood and bone marrow and to restore normal blood cell production. The third phase is maintenance therapy. The third phase of treatment prevents leukemia cells from regrowing. The treatments used in this stage are usually given at much lower doses over a long period of time, often years. For preventive treatment to the spinal cord. During each phase of therapy, people with acute lymphocytic leukemia may receive additional treatment to kill leukemia cells located in the central nervous system. In this type of treatment, chemotherapy drugs are often injected directly into the fluid that covers the spinal cord. So, masking pag na atong mahimo atong therapy sa 3 phases, gihapon siya additional nga treatment para jud mapatay ang mga cells na naka-located in the central nervous system. So treatment, depending on your situation, the phases of treatment for acute lymphocytic leukemia can span 2 to 3 years. So first is chemotherapy. Chemotherapy, which uses drugs to kill cancer cells, is typically used as an induction therapy for children and adults with acute lymphocytic leukemia. And chemotherapy drugs can also be used in the consolidation and maintenance phases. So pwede siya mag-chemotherapy drugs ka sa consolidation and maintenance phases nimo. Then second is radiation therapy. Radiation therapy uses high-powered beams such as X-rays or photons to kill cancer cells. If the cancer cells have spread to the central nervous system, the doctor may recommend radiation therapy. So this one is mag-use kag mga machines like X-rays na then if na-spread na jud ang cancer cells sa imong central nervous system, so i-recommend ni siya nga treatment sa imong doktor. Next is bone marrow transplant. A bone marrow transplant, also known as a stem cell transplant, may be used as consolidation therapy or for treating relapse if it occurs. This procedure allows someone with leukemia to establish healthy bone marrow by replacing leukemic bone marrow with leukemia-free marrow from a healthy person. So, kano siya kung i-change niya ang bone marrow. Yes, i-change niya ang bone marrow. So, katong nakay leukemia, nakay cells nga kuan, niya itong i-change. A bone marrow transplant begins with high doses of chemotherapy or radiation to destroy any leukemia-producing bone marrow. So the marrow is then replaced by bone marrow from a compatible donor. So engineering immune cells to fight leukemia. This is a specialized treatment called chimeric antigen receptor or CER T-cell therapy takes your body through fighting T cells, engineers them to fight cancer and infuses them back into your body. Another treatment is CAR T-cell therapy. It might be used for consolidation therapy or for treating relapse. Kaya siya pwede mo siya na magamit sa consolidation therapy gihapon. And clinical trials. Clinical trials are experiments to test new cancer treatment and new ways of using existing treatments. While clinical trials give you or your child a chance to try the latest cancer treatment, the benefits and risks of treatment may be uncertain. Discuss the benefits and risks of clinical trials with your doctor. So, i-discuss yapon sa imong doktor ang benefits and risks ani nga clinical trials na treatment. So, nursing diagnosis and intervention will be discussed by my co-reporter.
So, nursing diagnosis. So, number 1, impaired oral mucous membrane related to thrombocytopenia and chemotherapy. Number 2, risk for fluid volume deficit related to vomiting secondary to chemotherapy treatment and also decreased intake. Number 3, risk for impaired skin integrity related to radiation, changes in fluid status, imbalanced nutritional state, immunological deficit, and decreased mobility. Number 4, disturbed body image. So related to loss of hair and emaciation. Number 5, altered nutrition, less than the body requirements, related to anorexia, increased nausea and vomiting, increased metabolic demand. Number 6, acute pain and discomfort related to mucositis, leukocyte infiltration of systemic tissues, fever and infection. So number 7, hyperthermia related to tumor lysis or infection. Number 8, fatigue and activity intolerance related to anemia, infection, and deconditioning. Nursing interventions. So the interventions included in the care plan of the patient follows: first, before treatment, education. The nurse should explain the disease, the course, the treatment, and adverse effects to the patient. Infection. The nurse should teach the patient and his family how to recognize symptoms of infection such as fever, chills, cough, and sore throat. Bleeding. The nurse should educate the patient and the family how to recognize abnormal bleeding through bruising and pitted K, and how to stop it with direct pressure and ice application. So, promote good nutrition. The nurse should explain that chemotherapy causes weight loss and anorexia, so the patient must be encouraged to eat and drink high calorie and high protein foods and beverages. The next is rehabilitation. The nurse should establish uh, an appropriate rehabilitation program for the patient during remissions. Then, plan meticulous or supportive care. Meningeal leukemia. Watch out for meningeal leukemia, confusion, lethargy, or headache, and know how to manage care and after intrathecal chemotherapy. Then hyperuricemia. So prevent hyperuricemia, a possible result of rapid chemotherapy-induced leukemia, cell lysis through encouraging fluids to 2000 ml daily, giving acetazolamide and sodium bicarbonate tablets and allopurinol. So infection control. Control infection by placing the patient in a private room and instituting neutropenic precautions. Skincare. Provide thorough skincare by keeping the patient's skin and perineal area clean, applying mild lotions and cream to keep skin from cracking and drying, and thoroughly cleansing skin before all invasive skin procedures. The next is constipation. Prevent constipation by providing adequate hydration, a high residue diet, stool softener, and mild laxative, and by encouraging walking. The next is mouth ulcers. Control mouth ulceration by checking often for obvious ulcers and gum swelling, and by providing frequent mouth care and saline rinses. Psychological support. Provide psychological support by establishing a trusting relationship to promote communication. The next is manage stress. Minimize stress by providing a calm, quiet atmosphere that is conducive to rest and relaxation. Nursing management. So the care plan for leukemic patients should emphasize comfort, minimize the adverse effects of the chemotherapy, promote preservation of veins, manage complications, and provide teaching and psychological support. Thank you.